So I'll be looking at a definition of what they mean if they say benign disorders of eosinophils, okay? Or if somebody say benign disorders of basophils, all right? What do they mean by that set statement, okay? So be looking at the definition of the two conditions. I'll basically look at what makes a condition of eosinophils benign or not, okay? So we are to write short notes on the benign disorders of what eosinophils and what benign disorders of what basophils, all right? So let's get to it. All right, so for the definition of benign disorders of basophils is like this. It is an increase in basophils, all right? It's an increase in basophils where you're just having what? A slight deviation from the normal numbers of basophils that used to be in the body, all right? So if it goes above what? 0.1 times 10 raised to power 9 per liter, all right? That's if you're having 0.1 times 10 raised to power 9 basophils per liter, it is called what? Basophilia. That's increase in basophils, all right? But this one is benign. It does not actually shoot too much, all right? So say that this is a benign disorder of basophils, all right? Now, this is an uncommon condition, all right? The usual cause is what? Myeloproliferative disorders. That's any disorders that's basically what? Making the myeloid cells grow too much, all right? That's a myeloproliferative disorder. And examples of these myeloproliferative disorders include chronic myeloid leukemia, polycythemia vera, okay? Now, reactive basophils increases are also seen in conditions like what? Myxoedema, smallpox, chickenpox, infections, and in ulcerative colitis, okay? So you grab this figure up, all right? I just simply know that what? Benign, anything benign is just what? Mild. It's just coming up, right? So benign disorders of basophils is basically anything that is just making the basophils go up a bit, okay? We're talking about benign disorders of eosinophils right now. We said that what? These benign disorders of eosinophils are basically what? Causes of increase in blood eosinophils. And that is when the eosinophils are going above 0.4 times 10 raised to power 9 liters per liters. Okay, so you're having 0.4 times 10 raised to power 9 eosinophils per liter. Okay, then you know that what you're having a benign disorder of eosinophils, right? And causes can include parasitic infections like what? Amoebiasis, hookworm, and also when you are recovering from acute injection, all right? And also certain skin diseases like what? Urticaria, drug sensitivity, graft versus host disease, right? Basically, when you have like any transplant in you, your body kind of like be rejecting the transplant, so you have your body forming all those blood cells so that they can defend it, all right? So you might just have a mild increase in your eosinophils. Also, we have diseases like what? Hypereosinophilic disorder syndrome, sorry. We have allergic diseases such as what? Bronchial asthma, hay fever, all right? So sometimes no underlying cause is found. And when the eosinophils count is elevated above 1.5 times 10 raised to power 9 per liter for over 6 months and is associated with what? Tissue damage, then hypereosinophilic syndrome is diagnosed. Okay? So hypereosinophilic syndrome is like what? The worst version of benign disorders of what? Eosinophils, right? So also we see that the heart valve, skin, and lungs may be affected, and the treatment is usually with steroids or cytotoxic drugs. Okay, so that's it about what the benign disorders of what? Eosinophils and what the benign disorders of what? Basophils. See you guys.